Hypertension symptoms. High blood pressure is often called a silent killer because it doesn't always have outward symptoms. That means you could have it for years and not know. It can quietly damage your heart, lungs, blood vessels, brain, and kidneys if it isn't treated. It's a major cause of strokes and heart attacks in the US. What do the numbers mean? Normal blood pressure readings will fall below 120/80ths. Higher results over time can indicate hypertension. The top number, systolic, shows the pressure when your heart beats. The lower number, diastolic, measures pressure at rest between heartbeats, when your heart refills with blood. Elevated blood pressure, a warning sign. Elevated blood pressure is consistently just above the normal level, anywhere between 120 and 129 for systolic pressure and less than 80 for diastolic pressure. People in this range are more likely to get heart disease than those with a lower reading. Your doctor may suggest lifestyle changes to help get your numbers down. The hypertension danger zone. You have stage 1 high blood pressure if your systolic reading is between 130 and 139 or your diastolic is between 80 and 89. A reading of 140 or higher systolic or 90 or greater diastolic is stage 2 hypertension. You may not have symptoms. If your systolic is over 180 or your diastolic is above over 120, you may be having a hypertensive crisis, which can lead to a stroke, heart attack, or kidney damage. Rest for a few minutes and take your blood pressure again. If it's still that high, call 911. Symptoms include a severe headache, anxiety, and nosebleeds. You might feel short of breath or pass out. Who gets high blood pressure? Up to age 45, men are more likely to have high blood pressure than women. Things even up as we grow older, and by 65 it's more common in women. You're more likely to get it if a close family member has it. It's also widespread among people with diabetes. But in most cases, the cause isn't known. Sometimes, kidney or adrenal gland disease can bring it on. Race plays a role. African Americans are more likely to get hypertension, and at a younger age. Genetic research suggests they're more sensitive to salt. Diet and excess weight make a difference, too. Say no to sodium. Or at least watch how much you get. This building block of salt causes your body to retain fluid. That puts a greater burden on your heart and boosts your blood pressure. Aim for less than 1,500 milligrams of sodium per day. You'll need to check nutrition labels and menus carefully. Processed foods make up the bulk of our sodium intake. Canned soups and lunch meats are prime suspects. Get a handle on stress. It can make your blood pressure spike, but there's no proof stress keeps it high long-term. To manage it, stay away from unhealthy things like poor diet, alcohol use, and smoking. All are linked to high blood pressure and heart disease. Drop those extra pounds. They put a strain on your heart and raise your odds of having high blood pressure. That's why diets designed to lower blood pressure also aim to control calories. You'll cut out fatty foods and extra sugars, while adding fruits, vegetables, lean protein, and fiber. Even a 10-pound weight loss can make a difference. Caffeine is okay. It can make you jittery, so does caffeine also raise your blood pressure? It might for a little while, but there's no link between caffeine and hypertension. You can safely drink 1 or 2 cups of coffee a day.